On Twitter, as you know, you can follow people that you're interested in hearing from, right? And users would organically do that. What we wanted to do is to improve their connection graphs. What we wanted to make sure that users actually hear from people they're most interested in. They find shared interests. People and organizations can connect on Twitter and find common causes, common interests. So to do that, we looked at how users follow other users on Twitter and how can we apply collaborative filtering algorithms in the most efficient manner to solve this problem.
The value was immeasurable. The reduction in length of stay was 50%. Patients on average were spending 14 hours in the emergency room. That then came down to 7 hours after the implementation. The wait time in the emergency room was reduced by 30%. The number of patients that were leaving because they were tired of waiting was reduced by 30%. And at the end of the day, there was a savings to the institution of $30 million.
So many of the challenges are related to the fact that we are preventing disease, and therefore the impacts of what we do are not highly visible because of the children that are not paralyzed and the money that is not spent on activities. So trying to quantitate these benefits of polio eradication were a challenge to be able to quantify and express in ways that decision makers and donors could understand the value of contributing to this program.
We face the problem of having to optimize the output of 6 hydro dams in the Pacific Northwest. Our clients have a virtual slice of the output of this system, and through operations research we were able to optimize how much of that power within the constraints given to us by the operators of the dam each of our utility clients could take.
Look, it's important as a national infrastructure project for the NBN to be delivered as quickly and as cheaply as possible. And the work that we've done between the NBN team and the Biari mathematics team is helping do that by bringing the power of mathematics to bear on this important national infrastructure project.
So what the Alliance for Paired Donation does is we bring many of these kinds of people together in a large pool and find opportunities where the donor of one pair can give to the patient that needs a kidney in a different pair, and the donor from that pair can then give a kidney back to the other person, or other different kinds of arrangements where people essentially swap their donor's kidney in order to achieve a living donor kidney transplant for themselves. The Alliance for Paired Donation was very fortunate to be approached by Alvin Roth, now a Nobel Prize laureate in economics, who believed that he could help us use operations research to overcome the challenge that we faced of trying to maximize both the number and the quality of transplants that could be achieved. And this type of transplant has really transformed the field of kidney paired donation in the United States and now represents about 80% of the kidney transplants done through this mechanism. What that has done for the United States as a whole is it's not only improved the quality of care for these patients, but it's reduced the cost, because the cost of having a kidney transplant in the United States is much cheaper than the cost for paying for dialysis, and yet transplantation is a much better way to treat patients with kidney failure. Thus, we've achieved, through the work of Al Roth and the Alliance for Paired Donation, true healthcare reform, in that we've improved the quality of care and reduced its cost.
That wraps it up for Informs and the top analytics and operations research teams in the world. Learn more about analytics by visiting Informs online at www.informs.org.